Hi viewers, today we will see bone marrow aspiration and how to do biopsy. I am Dr. Kalaiselvi Xavier, Triple M College of Nursing. The objectives of today's class: at the end of the class, the students will be able to mention the meaning of bone marrow aspiration and biopsy, list down the purposes of bone marrow aspiration and biopsy, state the difference between bone marrow aspiration and biopsy, enlist the sites of bone marrow aspiration and biopsy, explain the understanding of bone marrow aspiration and biopsy, enumerate the importance of risk associated with bone marrow aspiration and biopsy, describe the how to prepare the patient for bone marrow aspiration and biopsy, explain the nurse's role of bone marrow aspiration and biopsy, and explain the complication of bone marrow aspiration and biopsy. A procedure bone marrow biopsy is a small sample of bone marrow is removed, usually from the hip bone, breastbone or thigh bone. A small area of skin and the surface of the bone underneath are numbed with the anesthetic. Then a special white needle is pushed into the bone. What is the meaning of bone marrow aspiration and biopsy? It is a small area of skin is numbed. A bone marrow needle is inserted into the patient's hip bone or the particular area to be investigated. The samples of the blood, bone and the bone marrow are removed for examination under a microscope. Bone marrow, the soft tissue contained in the medullary canals of the long bone and the interstices of cannulus bone, may be removed by aspiration or needle biopsy under local anesthesia. In aspiration biopsy, the fluid specimen in which pustule of marrow is suspended is removed. In needle biopsy, a core of marrow cells, not fluid, is removed. These methods are commonly used concurrently to obtain the best possible marrow specimens. Red marrow, which consists about 50% of an adult marrow, actively produces the stem cells that ultimately evolve into the red blood cells, white blood cells and platelets. And also the yellow marrow contains fat cells and connective tissues and is inactive, but it can become active in response to the body's needs. Bleeding and infection may result from bone marrow biopsy at any time, but the most serious complication occurs at the sternum. The other complications are rare but include puncture of heart, major vessels, causing severe hemorrhage, and puncture of the mediastinum, causing mediastinitis of pneumomediastinum. This is the anatomy of the bone, which has the subchondral tissue, cancellous tissue, marrow and compact tissue. There are so many purposes to diagnose thrombocytopenia, leukemia, granulomas, anemia and primary and metastatic tumors. To determine the causes of infection, to help stage disease such as Hodgkin's disease, to evaluate chemotherapy, to monitor myelosuppression. What is the difference between bone marrow biopsy and aspiration? Because the clinicals, the two types of procedure will be dealing in the bone marrow. The bone marrow aspiration is the procedure that removes a sample of the liquid portion of the bone marrow. Okay. Then the bone marrow biopsy removes a small solid piece of bone marrow. These are all the sites we can visualize: sternum, posterior superior iliac crest, most common site, and the anterior superior iliac crest. To understanding bone marrow aspiration is a procedure which involves taking a sample of the liquid part of the tissue inside the bones. And also the bone marrow is a spongy tissue found inside bones. It contains cells that produce white blood cells, red blood cells, and platelets inside large bones such as the breast bone, hips, ribs. WBC help fight infections. The RBCs carry oxygen and nutrients. The platelet enable the blood to clot. The complete blood count shows the number of red blood cells, white blood cells, and platelets, which can be abnormally high or low. If this happens, doctors may want to examine the bone marrow to find the cause. Bone marrow aspiration is often performed with a bone marrow biopsy. However, a different needle is used in the bone marrow biopsy to remove solid tissues from the bone marrow. While doing the bone marrow aspiration, how it is be performed? Because since it is so many conditions with unhealthy bone marrow, the preliminary test shows abnormal levels of the white or red blood cells or platelets. The doctor may order for the bone marrow aspiration. And also it helps to identify the particular disease and monitor the progression or treatment of the disease. And the conditions and disease related to bone marrow problems are anemia, which is a low blood cell count, bone marrow diseases, that is a myelofibrosis, myelodysplastic syndrome, blood cell conditions, that is a leukemia and polycythemia vera, the cancers, bone marrow and blood, leukemia or lymphoma, hemochromatosis, that is a genetic disorders, which is the iron increases in the blood, builds up in organs and tissues, and which leads to infection, especially chronic disease like tuberculosis, storage diseases like amyloidosis and Giogas disease. The risks, there are so many risks when you are inserting the needle into the objects or the bone, something to be happen. Here some of them list down: allergic reaction, excessive bleeding, infection, long lasting discomfort. The the most associated conditions, the cause weakened immune system and low blood count, and also the immune system can be more prone to get infection. Low platelet count increases the risk of excessive bleeding. How to prepare for bone marrow aspiration? Let the doctor know about all medications before doing the bone marrow. We have he is supposed to find out the over the counter medication or nutritional supplement, anything the patient is on taking. Should also let them know about any allergics the patient have, and also the patient doctor should know any medications if he takes before the procedures, and he shouldn't stop taking any medication unless the doctor tells. And also patient to tell the doctor if they have any nervous about the procedure. If really they have the nervous, means we have to support them, counsel them, and also explain the procedure which is not possible, the mild sedative to help the patient to relax, and follow any additional instruction to doctor before the procedure. This is the aspiration needle which could be puncture the site over the iliac crest. Then how the bone marrow aspiration is performed? The performation, the patient may be asked to change into the hospital gown, lie down on the side or abdomen. Patient body will be covered with a cloth, so only the area being examined is visible. The doctors will check the temperature, heart rate, blood pressure before the bone marrow aspiration. Before the procedure, patient will be given local anesthesia to numb the area where the aspiration will be performed. And also this is typically at the top ridge of the rear of the hip bone. Sometimes it may be taken from the chest bone. Patient may also be given a combination of IV medication by vein to help with the sedation and pain. This is the needle extends into the bone marrow. Here it is mentioned like aspirate site. How bone marrow aspiration is performed? Already it is like a doctor will insert the hollow needle through the patient's skin into the bone. The central portion of the needle is removed and the syringe is attached to draw fluid out of the marrow. They may be dull ache. Right after the procedure, the doctor will bandage the site, rest in the another room before going home. we have to follow for the patients when they are resting, and we should see the after the procedure of bone marrow aspiration. Patient may feel some slight pain for about week after the procedure. Patient can typically manage it with medications, pain reliever. Patient will also have to take care of the needle insertion site, keep wound dry for the 24 hours after the procedures, and also anything is ooze or anything is happen means inform immediately to the doctor. While carrying of the wound, bone marrow sample will be sent for the laboratory testing, and the follow-up review should be done by the patients. The procedure, patient preparation is very important. Explain the procedure. Mild sedation will be given 1 hour prior to the procedure if ordered. Tell the patient to test usually takes only 5 to 10 minutes, and that more than one bone marrow specimen may be required. Let him know that the blood sample will be collected before the biopsy for a laboratory testing. Make sure the patient has signed in the consent form, very important. Check the patient for hypersensitivity to the local anesthetic agent, and after confirming with the doctor, tell the patient with bone sternum, anterior or posterior iliac crust, vertebral spinous process, ribs or tibia will be used as a biopsy site. The implementation of by nursing care, aspiration biopsy. The doctors prepares the biopsy site and injects a local anesthetic. He then insert the needle through the skin, the subcutaneous tissue and the cortex of the bone. The doctors removes the stylet from the needle and attach a 10 to 20 ml of syringe. He aspirates 0.2 to 0.5 ml of bone marrow and withdraw the needle. Pressure is applied to the site 5 minutes while the marrow slides are being prepared. If the patient has thrombocytopenia, pressure is applied for 10 to 15 minutes. The biopsy site is cleaned again and the sterile adhesive bandage is applied. If the doctor doesn't obtain an adequate marrow specimen on the first attempt, he may reposition the needle or remove the reinsert it in another site within the anesthetized area. If the second attempt fails, a needle biopsy may be necessary. The needle biopsy, after preparing the biopsy site and draping the area, the examiner marks the skin at the site with a indelible pencil or marking pen. The local anesthetic is then injected intradermally, subcutaneously and at the bone surface. The biopsy needle is inserted into the periosteum and the needle guard is set as indicated. The needle is advanced with a steady boring motion until the outer needle passes through the bone's cortex. The inner needle with tripping tip is inserted into the outer needle by alternatively rotating the inner needle clockwise and counterclockwise. The examiner directs the needle into the marrow cavity and then removes a tissue block. The needle assembly is withdrawn and the marrow is expelled into the labeled bottle containing zincus acetic acid solutions. After the biopsy site is cleansed, a sterile adhesive bandage or a pressure dressing is applied. Nursing intervention. While the bone marrow slides are being prepared, apply pressure to the biopsy site until bleeding stops. Clean the biopsy site and apply a sterile dressing. Monitor the patient's vital signs biopsy site for the signs and symptoms of intent. Interpretations. The normal results: yellow marrow contains fat cells, connective tissues. Red marrow contains hematopoietic cells, fat cells and connective tissues. The iron satin, which measures hemocysteine, has +2 levels. The Sudan blocks B satin, which shows the granulocytes, is negative. The periodic acid Skippy stain, which detects the glycogen reaction, is negative. Abnormal results: decreased hemocysteine levels in an iron stain may indicate a true iron deficiency. Increased hemocysteine levels may suggest other types of anemias or blood disorders. The positive stain can differentiate acute myelogenous leukemia from acute lymphoblastic leukemia. Negative stain. The positive stain may also suggest granulation in Myeloblast. The positive PAS stain may suggest acute or chronic lymphocyte leukemia, amyloidosis, thalassemia, lymphoma, infectious mononucleosis, iron deficiency anemia, or sideroblastic anemia. Complications, already we discussed the hemorrhage and infection, puncture of the mediastinum. Precautions, know that the bone marrow biopsy is contraindicated in the patients with a severe bleeding disorder. Send the tissue specimen or slide to the laboratory immediately. Interfering factors, failure to obtain a representative specimen, failure to use a fixative or histologic analysis. Thank you. These are all the references.